Good afternoon, folks. This is Robert Chappell, Executive Editor at Madison365, with your daily update for Tuesday, May 18th. The update today is brought to you by Beyond the Page and the Ripple Project. Beyond the Page has a paid opportunity for diverse creatives to present humanities programming in Dane County libraries in 2022, so next year. This is part of an ongoing racial equity initiative called the Ripple Project. Pitch your program idea, and my understanding is it's pretty wide open, right? It could be a dance performance, it could be a dance workshop, it could be a poetry thing, it could be anything. It could be a history lecture series, it could be a storytelling series, anything that is humanities related, has something to do with racial equity, and can be done in a library here in Dane County. Beyond the Page will help fund it. Apply online by June 1st. Apply online by June 1st at beyondthepage.info/apply. And we appreciate their support of the update and of Madison365. Okay, the big news today. 2 weeks from now, roughly, is that right? About 2 weeks from now, Dane County will no longer require masks indoors, will no longer have any restrictions on capacity at restaurants and bars, will no longer have any restrictions on capacity, on the size of any gatherings, indoor or outdoor. Basically, what's happening is the current health order. They've been issuing, new health orders every month that restrict capacities, and say you have to have a mask on, and talk about distancing and everything like that. And these things expire after a month, and then they issue a new one, right? And each one, for the most part, changes a little bit. They'll get. In the fall, each one got a little more restrictive, and then now each one's getting a little less restrictive. And so this current order that we're under now, which has 75% capacity at restaurants, no outdoor gathering size, but you have to stay distanced, that kind of stuff. That current order is going to expire on June 2nd, and they're just not going to issue a new emergency order, which means Dane County will become basically, I don't want to oversell this, right? I don't want to make this like the huge sea change or anything like that, because it's not that much will change in reality, and it'll bring Dane County in basically in line with the rest of the state, which abandoned all caution months ago, right? My sense is they did say in the order, in the release, the story is on Madison365.org right now, so you can see some of the details. They're encouraging unvaccinated people should wear masks, but they don't have to, but you should. And Dane County is going to strenuously urge schools to still require masks for students, and part of the rationale for that, I think, is that by the time June 2nd comes, school, I know here in Mount Horeb, school is only going to have a week left. I think that's the case in most schools. So, why change anything for just the last week of school? So, I think my guess is also private businesses will be allowed to continue to require masks if they want to. Some of the statistics that were cited in this order: 63% of the population here in Dane County has gotten at least one shot. Well over 50% is completely vaccinated. Let me see, 53.6% are fully vaccinated, and the positive test rate here in Dane County is already really low at 1.1%. So frankly, Dane County could have made the case, would have had the rationale to ease restrictions or drop restrictions entirely probably a month ago, just based on the positive test rate. But I think wisely, they waited until we got to this level of vaccination so that the positive test rate will stay low at 1.1% or even less. So that's the thought. And the other part of it that they mentioned in the release was that just a week ago, 12 to 15-year-olds became eligible to be vaccinated. And already, just in Dane County, 16% of the population is vaccinated, or rather has their first shot, which, as I've mentioned before, does confer some immunity. Right? It takes a second shot and then 2 more weeks to get to full 100%, where if this is a video game, the bar would be full, but even just that very first shot begins you down that road, and your body begins to build the antibodies. So you become less likely to become infected and less likely to pass it on, even after just that first shot in the couple of days after that first shot. So the thought is that by the time June 2nd rolls around, Dane County will be, 70% will have one shot, probably 60% will have both. My concern, and you know me, I'm always concerned about something, is that that the message here is that everything, all the restrictions are going away June 2nd, so everything's fine now. I think a lot of people, I mean, frankly, since we heard from the CDC that unvaccinated people don't have to wear masks anymore, the guidelines are changing, it seems like people are just dropping it entirely now rather than waiting 2 weeks. From a messaging perspective, I might have held this announcement for 1 more week if it were me, but it's not. It's not me. So the other thing I'm concerned about is that statewide vaccinations are slowing down. So I think even though we're at 63% now, frankly, 70% to have one shot in the next 2 weeks feels pretty ambitious. The vaccinations have slowed so much that I'm not sure we're going to get 7% more of our population vaccinated in this county in the next 2 weeks. So my concern is that that this announcement feels like, this is not at all what the announcement says, but this announcement feels like we beat it. It's done. We're over. Everybody's happy. A lot of people are posting on social media. I can't wait till June 2nd. I mean, it's wonderful. It's going to be like this big emergence. It's like we're going to be this. We beat it. We're victorious, and we won't have beat it yet at that point. Sorry, but we won't. Even we'll drop all the restrictions and everything we find, but that doesn't mean. I mean, until the World Health Organization declares it eradicated, we haven't defeated it. Like, we might be perfectly safe here in our own little community, Dane County, to drop all these restrictions, and it might be fine, and there may not be another. I know there are a lot of people, as Dolores mentions, there are a lot of people who are concerned about another surge coming. I personally am optimistic that we won't have another surge. We might have a couple little bumps here and there, especially like next fall. My gut feeling is that we're going to have a flu season and a COVID season around September, October next year, or later this year, rather. I don't know. If we can get to that 70 to 80% vaccinated, then we won't have that. But the way things are going now, I'm not optimistic that we're going to get that level of vaccination. I think to get to 70%, to have one shot in the next 2 weeks in Dane County alone feels really ambitious to me. But we'll see. Maybe I'm not being quite optimistic enough. I think a lot of people will take this tack that Bobby is taking. Continue to wear masks in public indoor places, not because we have to, but because I know there are people out there who still are going to be anxious, and I don't want to contribute to their anxiety. Right? I want to signal that you don't have to worry about whether I'm vaccinated or not. Like, I'm vaccinated. I'm vaccine plus 3 weeks. I'm as immune as I'm going to get. I don't pose any risk to you, but you don't know that. So I'm just going to cover my face for some period of time, at least, just to let you know that I'm not one you have to worry about. You know, this anxiety is a big symptom of this whole pandemic, and I don't want to contribute to anybody's anxiety. Right? That's my thinking. And there is this issue. I have 2 kids who are 8 and 11 who can't get vaccinated yet. But the 11-year-old especially is old enough to carry this disease. I mean, they both are, but once you're 11, 12 years old, like you carry it like an adult would. And the B117 variant, we know, is more transmissible among children than the original COVID was. So, you know, there's that consideration as well. I'm not going to necessarily second guess the public health folks. They're experts. They know what they're doing. I think there is considerable pressure, whether it's real or perceived, to end this thing, even though it's not really ended. Right now, the other thing I'll mention, this does not apply to healthcare settings. I'm not sure that's true. I think this is entirely. I mean, healthcare settings are going to have their own their own rules. Like, I am certain that the emergency room in the hospital will require you to wear a mask. I don't know that. I guess I don't know that for sure, but like, I'm pretty confident that the healthcare providers will continue to require masks and distancing. I don't think, I could be wrong on this, but I see nothing in this announcement that says the county can order or is ordering any sort of restrictions on any healthcare providers at all. There's going to be, as of June 2nd, there will be no emergency order in place for Dane County. Nothing that applies to retail, nothing that applies to healthcare, nothing that applies to private gatherings, nothing that applies to anything. But so this order applies to healthcare just like everything else does, or just like it applies to everything else. But healthcare settings will certainly have their own restrictions, and they are perfectly free to do that. And I would encourage healthcare settings to continue a slightly elevated sense of diligence, despite all this that's happening at the county level, because people in healthcare settings are going to be the more vulnerable people, right? So that extra level of diligence is definitely warranted in that setting. Okay, so and the other thing I mentioned too, City of Milwaukee. This concerns me even more than Dane County, to be honest with you. City of Milwaukee's current health order was due to expire June 15th. Mayor Tom Barrett moved it up to June 1st, at which time, or moved the expiration of that order to June 1st, at which time the all mandates, mask mandates, everything will expire on June 1st from the City of Milwaukee. I don't know statistics for the City of Milwaukee specifically, but the Milwaukee County, I believe, does not have the level of vaccine to warrant that decision right now. 43% of the population in the Milwaukee County has had one shot. 36.8% is fully vaccinated. That's not enough. I don't think. That's not enough to drop the masks in Milwaukee. And I hope people understand that, and I hope people voluntarily decide, if you're unvaccinated, even if you're vaccinated, keep the masks on for now until you can get those numbers up. We know there are disparities in vaccine distribution. We know it's very difficult. We know the state is working hard and trying hard. David Crowley, the county executive of Milwaukee County, is working really hard to get over those disparities. But until Milwaukee County catches up with Dane County, I wouldn't drop masks in Milwaukee County. If it were me, if I were mayor of Milwaukee, I am not mayor of Milwaukee. I'm just a journalist who can lob criticism at elected officials. It's kind of part of the gig. It's kind of part of what we do. So that's what I'm doing right now. Mayor Barrett, it's too soon. I just believe it's too soon. Okay, so but let's talk about the actual good news with regard to the actual COVID numbers for today, which continue to be good. And this is and until these numbers get bad, I'm going to be very hesitant to second guess any easing of restrictions, because every time we ease restrictions, everybody goes, "Oh, there's going to be a big spike," and then there isn't a big spike. Okay, so until I see a big spike, then we can go back and say, like, see, it was too early. But 481 new cases today, still kind of a lot. That's on 4,000 tests. So about 12% of the new tests reported today are positive. That's pretty much in line with where we've been recently. The best news of the day, positive test rate overall, the 7-day positive test rate, the percentage of tests in the past 7 days that came back positive, 2.7%. That's the lowest it's been. Let me see. That's the lowest it's been in more than a month, for sure. Yeah, I don't even have 2.7 on my spreadsheet, and my spreadsheet goes back a month. So that's great news. We want it to stay below 3.0%. Public health folks would tell you if it's below 3.0, that indicates that you have this thing mostly under control. You're testing enough, you're contact tracing, right? So that's great. We do report 13 fatalities today. Unfortunately, I haven't had a chance to look at the dates of those, but I would guess that most of those are more than 2 weeks old. Our total death toll now is 6,971. We continue to get death certificates confirmed from December, January, February. So I would wager that we've actually lost more than 7,000 people by now, which is tremendously terrible. And we're just still catching up on getting those confirmed. So that, that's the decent news, I guess, is that the spread continues to slow, aided in part by vaccines, I'm sure. But also aided in the fact that we're just all still being vigilant, and I hope we continue to be vigilant, even if we aren't required to be by the government. Right? We can all continue to just respect each other's space and all that stuff. Our daily average of new cases is down to 419, which is pretty good. As I mentioned, vaccinations continue to slow down. We're at about 22,000 vaccine doses given per day, which sounds like a lot, but that's a third of what it was in April. 64,000 in April. 15,000 looks like new shots given in the past 24 hours, which is just not enough. So if you are in that, given that the government is dropping it at the local level now, the state level dropped the ball a long time ago. But at the county level, the city level, we're just deciding that this is over, I guess. It is incumbent on us to do it then, to take care of this problem. And the one thing you can do to solve this problem faster than anything else is to get yourself vaccinated. If it is an inconvenience for you to miss a day of work, like, get over and do it. If you think you're still waiting your turn is now. Get it taken care of. Don't wait. Don't be like, oh, I'll let other people who need it more. No, just get it. Because you getting vaccinated helps everybody around you, right? If we as a state, we as a community are trying to get to 80% vaccinated, every single person is one tiny fraction of a percent toward 80, right? If you feel like your vote matters, your vaccine matters. Think of it that way, okay? So, and also understanding that, especially like in Milwaukee County, and also in several sort of the more rural areas, the Hmong community in central Wisconsin, and the Latino community in Green Bay, they have significant actual barriers, like really circumstances that make it really difficult for them to get vaccinated. So if it's just an inconvenience for you, find a way around it. Get over it. If you have a significant barrier, talk to your local health department. There are lots of agencies and government agencies and nonprofits working hard to get those over those barriers. Oh, Pernisha, this is great. I'm going to want to talk to you about this. We will report on this. We'll do a news story on this, Pernisha. So I'll message you or something about this. Folks, we're talking about Juneteenth at Penn Park. That's fantastic. So Penn Park's outside of Madison, and then a fallback kicks day in the park. That's outstanding. I will be in touch with you about that, Pernisha. This is interesting. Bobby mentions that, so you don't want it? We're going to send it to India. That's actually not a bad idea, because you tell affluent suburbs that the vaccine that's sitting there waiting for them might go to like brown people on the other side of the world. Maybe they decide to get it. That's actually a really, really clever thought. All right, that is the vaccine and coronavirus news. That was kind of big news, so it took a little extra time, but we have more local and national and state news to cover real quick. So don't go away. I will have a short word here from UW Health, and we'll be back to finish up the local, state, and national news right after this.
Here in the Midwest, community is important.
Having a healthcare system that's looking out for us,
that's actively addressing the racial disparities in healthcare is important.
When we can get good quality care, we can do more. We can achieve more.
We can be the kind of community we want to be, and that's really important.
UW Health. Remarkable medicine. Remarkable care.
All right, we're back. Thanks for sticking with us. On the site today at Madison365.org, we've got a profile of the Sanchez Scholars Program, which turns 21 years old this year. Roberto Sanchez, retired professor at University of Wisconsin, established this fund to help Latino and Latina students from Madison attend college. It's expanded now beyond UW to Madison College and Edgewood, and it identifies promising young Latino scholars as young as 8th grade, to kind of support them, help them through high school and onto that sort of college track. The new scholars, the 8th grade scholars, have been chosen and named this year, and the application for the scholarship, for the college scholarship deadline application, is coming up on June 1st. So Madison365.org right now. Got some really, Dave Dahmer did this story for us and has some really nice reflections on some alumni of the program who are still around Madison, who are, starting law school, or who have been or working as psychologists, and, things like that. So very, very positive program, and a good story from Dave. State news today: the Department of Health Services, which used to be DHFS, is now just DHS, is creating an Office of Health Equity, understanding that, it's not just COVID. Okay. Healthcare, generally speaking, has, been just plagued by racial disparities forever. Right. You look at, just access to healthcare. Yeah. You look at, preventable diseases. You look at, maternal health, infant mortality, food insecurity, things like that. It's just, there's this deep disparities in healthcare. And in fact, I want to say, I think it's 170 jurisdictions across the country, cities and counties mostly, have declared racism to be a public health crisis. So with all that in mind, and understanding that COVID this year has shined a light on that even more starkly, right? The disparities in COVID outcomes was just black and white, plain as day. In the numbers, you can see it every day. That black people were much more likely to die. Latinos were much more likely to be hospitalized than white people, for a number of reasons. So with all that in mind, the DHS is creating this Office of Health Equity and giving it a budget, which is important, right? This could be all talk or it could be real action. And this office will have some say over the whole department's budget and just how the department works. So I think I feel like that's a positive step. And they're currently recruiting for that position, for somebody to direct that new office. And they're going to allow that person to then build a team to run that office. So, it's kind of a pretty big deal, I feel like, that the state is recognizing that, healthcare is not colorblind. Health is not colorblind. It's just not. So that story also is at Madison365.org this morning. National news. This is Mike Elliott, the mayor of Brooklyn Center. You remember Dante Wright was shot and killed by a police officer. He was pulled over because his license plates were expired. The police found an arrest warrant, and she thought she was tasing him, but she shot him. The police officer who shot him is made her first appearance in court on Monday, scheduled for trial on manslaughter charges in December. But in the meantime, the city council there has taken really strong action. And basically what they did is, right after this all happened, there were protests, and the police department cracked down on the protests, and the mayor fired the police chief and the city manager who was overseeing the police chief. And the city council moved the authority over the police department out from the city manager into the mayor. They were not messing around. It was really kind of impressive. And it is tremendously terrible and tragic that a young black man had to die for this reform to take place. But it was a big shakeup immediately. And what they've done now is at the city council level, and I'm not sure if this will get challenged in court or not. And I'm not sure. I'm going to try to get the mayor of Brooklyn Center on this show. And I'm also going to reach out to some local folks about their reactions to this and whether this would work here. But they're creating a mental health, I don't know, task force is the right word, or mental health response team. Because part of the problem is when somebody's having a mental health crisis, you call the police, and a bunch of people with guns show up, or somebody's having a mental health crisis, and a bunch of people whose mandate is to arrest that person show up at a mental health crisis. We saw this happen last year, 2 years ago now, when a young man from West High School was having a mental health crisis and got punched in the head a whole bunch of times by a cop. Because the cop was not there to do his mental health treatment. The cop was there to take him into custody, and that's how police take people into custody, if they have to. So that's one thing. So that they'll have a civilian expert on mental health, unarmed group of people responding to mental health crisis. They'll also have an unarmed traffic division. So that if it's not speeding or driving recklessly or drunk driving or anything criminal like that, if it's your tags are expired, your headlight is out, that kind of stuff, your registration is expired. Those will be unarmed officers taking care of those issues. And my understanding is that our local police chief here in Madison, Sean Barnes, is open to that kind of idea. His comment when we had our town hall with all the black police chiefs, his comment was, that kind of stuff is between you and the DMV. I don't care. Like, you don't need somebody with a gun taking care of that issue. And then the other thing is that police would not even be allowed to make arrests except in the case of felony offenses. So if it's a misdemeanor you're charged with, if it's a little bit of shoplifting, or if it's even a driving violation that's a misdemeanor crime, or disorderly conduct, or public intoxication, that kind of stuff, they're not even going to be allowed to make an arrest. Because a lot of the issues happen when people are resisting arrest. So if the police are not trying to make an arrest, there's nothing to resist and nothing will get out of hand. They'll write you a ticket if you're a misdemeanor. So I don't know yet how the Brooklyn Center Police Department is dealing with this, but specifically that traffic thing would have saved Dante Wright's life, because it would, like, the people, like, what happened, was he started to resist, and she tried to pull out her taser to subdue him, and she pulled out her gun instead. And they're saying there should not be a gun in that situation. There should be no gun to grab in that situation. So that's it. That's their they passed these reforms with a 4-1 vote on the city council. I think it's remarkable. I think it's a big deal. Who knows if it'll work? Who knows where we'll be in a year from now, if we'll decide that this is a great idea everywhere in the United States, or if we decide this was the biggest mistake the city council ever made. But it seems to me to be worth a try. So I'm going to talk around a little bit around Madison here to see if anybody any law enforcement officers or leaders or community folks have thoughts on this. But until then, that's the news from Brooklyn Center, Minnesota. Sorry about that. It was a stray click hitting on an ad that wasn't supposed to be running. Sorry about that. Okay, so that's the news for today. If you value this news and staying informed, appreciate a donation. We are a nonprofit newsroom. We will never charge for the news. We're never going to charge you to subscribe. But if you would subscribe to this, what would you pay? What would you subscribe? Would you do $5 a month if I asked for it? Would you do $10 a month if we said to get Madison365 news is going to cost you $10 a month? Would you do that? A lot of people can't. So if you could do that, go to Madison365.org/donate. A couple of clicks, you can set up a $10 a month recurring donation. Think of it as your subscription. All of that, everything that's donated goes right back into the reporting. We don't really have much in the way of overhead. We don't pay rent at an office. We don't do a lot. We have very little administrative staff. Most of what you give us goes right back into the journalism because our reporters are great and they're professionals, and we pay them as professionals. So that's all I have for you today. Appreciate your attention and your time. It's a beautiful evening. I hope you can get out. And I say that as a Wisconsin person. A beautiful evening when it's raining is still a beautiful evening. So I hope you can enjoy it. And we'll have It's Only 10 Minutes podcast first thing tomorrow morning. And I'll be back here tomorrow at 4 o'clock as usual with all the latest news. Follow us on Facebook, follow us on Instagram, follow us on Twitter. Keep up and keep informed. Have a great night.
This is 365 Media.